My name is Rakan Almana, and I'm 17. In October of 2024, I got some of the most devastating news of my life. I was diagnosed with a chronic immune-mediated disease called eosinophilic esophagitis, also known as EOE. What this disease is it's chronic, so there's no cure to this. And it's caused by food and environmental factors. And symptoms include inflammation in the esophagus, which is what connects your throat to your stomach. So as you can imagine, when you eat food and it's inflamed, sometimes it gets stuck. And sometimes it's impossible to flush down with water, and you need to even get hospitalized. Now, ever since my diagnosis, I've been on treatment like long-term medication, and I've had medical procedures and lifestyle changes. And these long-term medications reduce these symptoms and inflammation, as well as the lifestyle changes, like I've been on the 6-food elimination diet, which eliminates wheat, eggs, dairy, soy, fish, and nuts, which is in almost every food we eat, and endoscopic procedures every 2 months. When I was researching more about treatments for this disease, I found that there was a treatment to lessen the harshness of my current treatment plan. So I wouldn't have to be on medications that could reduce symptoms and inflammation and be on lifestyle changes. And I wouldn't have as much frequent endoscopic procedures. So I asked myself, why go through with this treatment when there are less harsh ones? And the answer was simple. It's not available in Jordan. So then that sparked a bigger question in my mind. Why should where you live decide whether you get access to healthcare or not? And for millions and billions of people, it's true like that, because there is a global inequality in our healthcare system that exists. As individuals, we need to recognize that medicine is more than just science. It's a reflection of our justice, and it's a basic human right. It falls under the same lines as access to water, access to food, and access to education. The drug I was talking about that could potentially lessen the harshness of my treatment plan is called Dupixent. And to access it, I would have to go travel to Dubai and pay $3,000 per injection and take one every week. And you could already see how this is a financial strain. We have the knowledge, we have the technology, and we even have the medicine. It's just some people don't have access to it. This inequality reaches far beyond me. People in Africa, for example, diabetics still can't get access to insulin, which has been a drug that's been around for over a century. In some parts of the Middle East, cancer patients don't get the same standardized treatment as patients in the US, UK, or Germany. And in COVID-19, while developed countries got vaccines, developing countries waited months to get vaccines, slowing them down economically and to prosper as a country and to develop more. Now, according to the World Health Organization, about 80% of medical research is funded by developed countries. And most of the research they do is about diseases that are more frequent in developing countries. And when these governments cut research funding, it doesn't only affect them. For example, like in the US, when the US cut cancer research, it didn't only affect the US, it affected the countries depending on the US's research, because developing countries sometimes cannot afford that medical research. And the result of this is that it could slow down the progress for finding a potential cure or treatment. And that's not what progress should mean. Because if we are truly in the essence of a changing world, then we should prosper as one global world and have equality in our healthcare system. And now, you might be asking yourself why I'm telling you all about this. It's simple. We need to spread awareness. Spread awareness to governmental organizations. For example, asking them to make policies, create policies that could potentially bring new medications to countries that don't have them. Pitching to pharmaceutical companies to lower budgeting on to lower costs on certain medicine so that more people can have access to it. And also spreading awareness through communities like your friends and families that could potentially reach stakeholders. I want you to take a moment and think about the last time you had a headache and took a Panadol. Now imagine you didn't have that Panadol. And for millions of people, it's not an imagination, it's reality. So what we need to do, what I'm asking you to do, is to recognize that healthcare is a human right and to be compassionate for this, because even if it doesn't affect you, we have to spread awareness for this so we could prosper with an equal healthcare system throughout the world. And someday someone's life might depend on medicine that they didn't have access to. And that's something we can no longer ignore. Thank you very much.